justice to that and teach us what ectopic pregnancy basically means and how we can even notice that at any time so that we can do something about it, visit the health facilities and get that fixed so that we do not end up experiencing a lot of miscarriages in our lives as women. So I've been joined in the studio by resident midwife Rabiato Afariwa Asari, and at a point in time we'll activate the phone lines so you can call it and then ask your questions. The WhatsApp platform is always active. You can start sending your messages even now. Whatever question you have concerning ectopic pregnancy, they are always welcome. We'll answer them once they're questions and read them out once there are contributions and submissions as well. And should you miss the segment, you do not worry at all. We are active on YouTube. It's Hstv GH Live. You can head on there at any time and then you can watch that and leave your thoughts, comments there as well. I always tell you that the people we bring here are certified and authentic, so answers to your questions are always the best. So join me, let's have this conversation with my guest Rabi on ectopic pregnancy. Rabi, good morning and welcome.
Good morning. Thank
How's
you.
Your weekend?
It was okay.
Okay, and how is preparations for the weekend fun thing?
We are on it.
Okay.
We are on it. Yeah.
I hear the bus is full already.
Yeah.
Okay, I'll come with my own bus.
Sure.
And have fun. Okay, talking about ectopic pregnancy, it looks like that there's a disruption in the pregnancy.
Mm-hmm.
So before we get into that, I want you to explain to us how the formation of pregnancy is all about, so that we can deeply understand it when we say the ectopic pregnancy.
All right. So before a woman will become pregnant, she first of all has to ovulate.
Okay.
Yeah. So when we say she's ovulating, she's actually releasing an egg, a fetal egg, to be fertilized by a sperm.
Okay.
And then it turns to a pregnancy.
Okay.
Now, when she ovulates, what she has to do is she has to get intimate. That means she has to partake in a sexual intercourse with a male partner.
Okay.
Sorry.
When we say you're ovulating, do you as a woman, would you feel something that you're ovulating so that when you want to get pregnant, then now you can go have sexual intercourse?
Yeah, there are signs and symptoms that you experience, but it varies with every woman.
Okay.
But the cardinal ones are that some would say they feel some sharp pain at the side of their abdomen. So it could be at the left side or the right side.
Sharp pain.
Yeah,
that means
sharp.
you're ovulating.
Yes.
It means you do anything. Why should I go?
Yes, exactly. Okay. And then some would have, the urge to get intimate.
Okay.
Yes.
Okay.
Others will be glowing with nice breasts and,
Really?
Yes. it's you see, in the animals kingdom, the males and females have signals when they want to mate.
Okay.
Exactly.
Okay.
So with us, the human beings, that is the sign that the woman sends to the male that she also wants to get intimate. So her breast becomes firm and nicer than usual. Some would say it's heavy with pointed nipples.
Okay.
Yes. Some would have a glowy face. Yes. Some will be having extremely high libido than they usually have. Exactly.
Okay.
And then when you come to the vaginal area too, you realize that she becomes a little bit wet than usual or moist. Okay. And then in case she is able to fetch some of the fluid that comes from her vagina, you can test it and then you realize that it's snappy. When you're not ovulating, the fluid there, the discharge, which is usually clear like egg white, the egg without the yolk, it becomes clear and stretchy. So if it is stretching, that means you can't get pregnant. You are not ovulating. However, when you are getting closer to the ovulating day, maybe 2 days a day to the ovulation day, this stretching becomes a snappy one. So you stretch and it snaps. A better.
Okay.
You won't even have to stretch a long time. Yes.
So these are the cardinal points to let you know that you're ovulating.
Exactly.
As a young lady, or as a woman.
Yeah.
So how long can you ovulate?
Usually it's a phase.
Okay.
The egg travels. So as it is traveling, we say you are in your fertile phase. Okay. So this traveling may take about 5 to 7 days. Again, it depends on the woman. So the first 3 days, we can say you are in your fertile period. And then the D-day that the egg comes out and stays, we say you are in your ovulatory day or ovulation day. Okay. Now, when the egg comes, it stays for about 12 to 24 hours. And then it crashes. Yes. So it travels to a place called the ampulla. The ampulla is part of your fallopian tube. It stays there for up to 12 or 24 hours, again, depending on the woman, depending on how fertile you are. And then if you get intimate or you have sexual intercourse, when the egg is available, you fall pregnant. However, if you don't get to get intimate, after the 12 hours, the egg starts to crash, and then by 24 hours, the egg is crashed. We say it has degenerated, or it is dying, or it has died. And then you go to your safe period where whatever you do, you cannot get pregnant. Yeah, that's how it is.
That's how the ovulation period is about. So let's come down to the formation of the pregnancy.
All right.
Okay, let's continue from the ovulation.
Yeah. So now the lady is ovulating, and she has had a male partner, and they've become intimate.
Okay.
Yes, they've had their sexual intercourse. Once the sexual intercourse starts and the man ejaculates, the sperms take up to about 15 to 45 minutes to get to the egg.
To the egg.
Yes.
Okay.
So that means by the time you are done with your whole scene, your whole action, and the man is out of you, the sperms have entered your system.
Okay.
So this excuse that we get our girls saying that you have to stand and then shake yourself, you have to drink pure water and chilled water
to do what exactly?
to wash the sperms away. That's what they think.
Okay. That's when they don't want to get pregnant.
Exactly. They
have
think
to
that
stand and shake
themselves so that the sperms will pour out. Some would say you have to wee as soon as he's done. No. All
but
these
you feel
excuses.
You want to wee?
It's important for you to wee after sexual intercourse, but that doesn't prevent pregnancy. It actually prevents infection, possible infections.
What's the medical correlation here for you to pee before after right after sex? What's that?
All right, so during sex, you know that there's friction involved, up and down, sweat and all that. We believe that there are little particles that we can see with our eyes that may enter your bladder. Now, the bladder has a gate called the urethra, and the urethra is just a bit above your vagina. So usually they see it as that being the vagina instead, but the urethra is up there small, and then you find your vagina down there.
So it means when the pee comes out is different from
exactly vagina, very good, but we think they come from the same place. No, the pee or the wee comes from the upper part, which is the urethra, and it's small, and then the menses, and then the sperms, and then the baby comes from the vagina, which is down there a little bit below.
So the menstrual blood comes from the vagina.
Exactly.
But the urine comes
from the urethra. Yeah. So when you we believe that you push anything that comes and that may have gotten stuck to the urethra, you push it away, and then you won't get any infections, especially UTI. That is why we ask that you wee after you get you have your intercourse.
Even if you don't feel the urge to pee, you should.
You have to try and do something about
right
it.
After sexual
exactly.
intercourse. Okay, let's get back to the conversation. So after the man is out of you, about 15 to 45 minutes, the sperms have already traveled.
Exactly. They now start their race. So the sperms travel from your vagina through to your cervix.
Okay.
When you are ovulating, your cervix opens up a bit to allow the sperms to enter. But if you're not ovulating, the sperms close up. The cervix, the cervix closes up, so the sperms just go and hit and then go back. Or even if they are able to penetrate, the mucus, the slimy thing that we see around the cervix is very thick, so it's hard for the sperms to penetrate that thickness into your vagina, your womb or your uterus. But if you are ovulating, this thickness becomes very light, so the sperms can easily swim through and then into your urethra or your uterus actually. So now the sperm has entered your uterus. It travels up into your fallopian tubes in search of the egg. So if you are ovulating, the egg will be at the ampulla waiting for the sperms to come there. They get there, and then the egg allows the sperms to penetrate it or fuse with it, and it becomes fertile, and then we say an embryo has formed. The embryo is like the beginning of the whole pregnancy issue or the whole pregnancy process. So once the embryo is formed, now the egg comes down back into your uterus or your womb, and then the pregnancy process starts. That means the baby making process has started. Now once it comes to your womb or your uterus, it gets fixed to any part of the uterus. And then now it forms a sac, and then a baby starts forming gradually over a period of 9 months.
Okay, so that's the normal formation of pregnancy.
Exactly.
So when we say ectopic pregnancy, it looks like then things are not going as normal as it's supposed to. So what exactly does ectopic pregnancy mean?
So now, with the explanation I've given for the normal pregnancy, you can realize that once it gets fixed or fuses with the egg at the ampulla, it walks back into your womb or your uterus. However, in ectopic pregnancies, it refuses to walk back into your womb and then gets stuck at the fallopian tubes.
Why?
We don't know, but we believe that there are certain days or certain women who have problems with their fallopian tubes.
What kind of problem? Because they are eating something they're not supposed to eat? I was asking earlier, I was having a conversation with Diego earlier. Is it because there's something wrong with the sperm? You didn't push the egg to run through the fallopian?
No, not necessarily the sperm, not necessarily the egg. It's just the fallopian tube of the woman. Now we have abnormalities that may occur while she was growing up, while she was being formed in her own mother's womb, or her own behavior. She had infections and she didn't treat them properly.
Wow.
Yes, something like PID actually can lead to someone having.
Does that mean?
PID is pelvic inflammatory disease.
Okay.
Yes, so it's like you have infections over there, and instead of you to treat it properly, you don't. You take your medications halfway and then you leave it.
Oh.
Yes.
And you end up growing with that.
Very good.
So it creates
it's mass or scrapes, or let's say it injures the fallopian tubes. The tubes are very delicate. Okay,
so does it mean such a woman who has had infections like this PID you're talking about, never really treated them, and she gets pregnant and it's ectopic pregnancy? It means all her pregnancies will be ectopic?
It's likely. It depends on when we spot the ectopic pregnancy and how fast we are able to treat it for her. Then she might lose one fallopian tube. We have 2 tubes. So if you put your palms together, you can get the 2 tubes. So you have the left side and then the tiny right side too, and then the middle part will be your womb area.
So it means that the sperm pushed. So where are the eggs after the sexual intercourse?
So the egg actually starts from here, somewhere around your fallopian tubes.
Either right or left?
Either of them, any of them that releases the egg.
How many eggs do we even have?
We have uncountable.
Oh, okay. So they're all
lots
around the fallopian tube?
No, they have their own chamber that they come from. Every month you release one from the left or the right, or sometimes 2.
Oh, that's where the formation of the twins and all of that.
Exactly.
Okay.
So now,
so where are they before they even get into the fallopian tube?
So they are in their chamber down there. So when you look at the image of a fallopian tube, you can see that it's something like this.
Okay, yeah, I've seen that.
Yes. And then you have some small bowl down there.
Yes.
So as it's like this, these are the fingers of the fallopian tubes. Every month it fetches one of the egg. So it can fetch from the left side or from the right side.
Or from both.
From both.
Okay.
Very good. And now once it fetches, it begins to walk. Day by day it walks. Day by day it walks until it gets to the ampulla, where it sits for a while, because the environment there is conducive for both the egg and then the sperms. So it sits there for a while. Let's say this is my ampulla, so the egg sits here, and then waits for any sperm to fertilize it.
So the sperm will run through the cervix.
Very good. So the sperm is coming down there, traveling up to there. Okay, so it keeps going up, searching for the egg till it gets wherever the egg is.
Okay.
And then when it gets the egg, they fuse together there and become the embryo, and then now they come back again to the womb.
Okay, so when it's ectopic, it means that the egg is still there.
Yes.
And the sperm will also rise.
Very good.
Go through.
Very good. So I've fetched my egg. The egg is traveling. It gets to the ampulla, and then it gets fertilized by the sperm.
Okay.
However, instead of it to move down to the womb area or the uterus area, it refuses to move.
And that is where you're saying that abnormalities come in.
Very good.
Like you don't really know the major.
You don't know. So we have abnormalities, we have genetic problems. That is, she came with it from wherever she was born from.
Maybe she can never have a baby.
She can. She can if it is treated early enough.
Okay.
Sometimes we will spot it and then we cut your fallopian tube. Maybe it could be the left side or the right side. And then we cut it and then, we do your surgery for you and can have babies. So now, the way we can picture how a baby is, how heavy the baby is, that is how it's supposed to grow in the womb, because the womb or the uterus is able to extend enough. But imagine this small tube. with a baby as big as wherever, a loaf of bread, growing here. It won't be able to grow. That means it will lead to a rupture. So usually ectopic pregnancies lead to ruptures of these fallopian tubes because it can't hold the baby. The baby is too big for it to hold. All right.
Oh, okay.
Its function is to give you egg. So imagine this small egg. That is what I can do. So I've been designed to be able to hold just egg, and now you want me to hold a baby.
No,
it won't be
really
able to. Exactly.
Wow.
So it's ruptures, and then it can lead to death.
Death of the woman.
Yes, the woman.
Wow.
Because for the baby won't form. No matter what you do, it won't be able to grow.
So will it even grow? You know, we have stages.
Yes.
We have the zygote, fetus, embryo, and all of that. Where at what points will it grow to?
It can go as far as the fetus, but that is where it will rupture.
And it's all growing
at that small place.
Exactly.
So you can imagine, it will rupture and then you pass away or you pass out. Anyhow.
So when it happens, so when it happens like that, of course you can't have your baby. So your baby is at risk.
Yeah.
You, the mother, you really can't survive that.
You can't survive. You are extremely at risk. It's supposed to be in the womb. Okay. So anywhere apart from the womb is a no-no. Your body will react to it.
And then, so something like this, does it come in pain?
Yeah, excruciating pain. Like I said, I have to hold an egg. My cup is supposed to hold just an egg. And now you want me to hold a baby. I can't. The pressure will be too much for me. And I'll send messages to you that, no, I can't do this.
Okay.
If you force me, then I'll crash.
Okay.
Yes, that's how it is.
Okay. I was surfing the internet and then I realized that women who smoke a lot are actually prone to ectopic pregnancy. And I was trying to understand and wrap my mind around it, how smoking can, have your eggs get stuck inside the fallopian tube and all of that. And I really didn't get that.
All right. So with the smoking, this is where the problem lies. Again, you get to, scar your internal organs with the smoke that comes with it. You can realize that there are pictures around where they give the picture of someone who is smoking from a picture of someone who is not smoking, and then the smoker's picture or internal organs are darker, or they look like they are all inflamed. Okay, so you smoke a lot and then you inflame the internal organs, and then inflaming them will lead to sore. So wherever the smoke will get, wherever the toxins will get to. Okay. So first we've said that it will affect your hormonal levels. So now the scars, the smoke is inside you. It brings in toxins. Okay, the toxins will get to fuse with other important chemicals in your body, and then they will change their shapes or their ability to work properly. And that is where the ectopic pregnancy may set in, because you are not able to send off enough hormones. Okay, we are pregnant. We need 3 cups of water to push the egg to the womb. Now, I can't give you the 3 cups of water because my messengers or the carriers of the cups, they are a bit sick because madam has been smoking. So we can't give you, we can only give you 2. And maybe 2 can push the egg to just a part of the fallopian tube, and then there's a problem.
Okay, so this is actually something the woman herself is doing. It's not like this abnormalities or something that she was born with or something. Something she's doing. How about other health risk factors?
So other risk factors are not necessarily dangerous as compared to the smoking and then the infection, the PID. So someone is having gonorrhea, a girl is having gonorrhea. Instead of her to treat it properly, she's either shy, she's either stubborn, or she's either oblivious of the infection. So she treats it anyhow. She just gets some painkiller from the shop, and then it works for her. So she's stuck on painkiller instead of the real deal. So this graduates for it. So you can see that whereas someone else is smoking, she's doing it by herself. The other lady is also not treating herself properly. So these are the external personal factors that will lead to the ectopic pregnancy, possibility of it.
And this gonorrhea has a tendency to cause ectopic pregnancy.
Exactly. Gonorrhea, chlamydia, all the STIs when it is with a woman. With the men, when they get the STI, it's easy for them to treat because they have gonorrhea for about 6 months and she won't know it. So imagine.
Why the symptoms are not visible in
they
women?
Go in and then the female reproductive tract is complex. You have the fallopian tube, you have the egg, you have the womb, you have the vagina, you have the cervix, you have this and you have that. The male reproductive tract is, let's say, the penis, the bladder, and the prostate. It's much simpler, so it reacts easily. However, with the woman, the bacteria or let's say the infection has a lot of places it can visit before it decides to come out. So it will visit your vagina, eat that place, visit your cervix, eat that place till its satisfaction, and then penetrates deep into your womb. It eats the womb and then goes to the fallopian tubes, eat the fallopian tubes, and then go to the eggs, eat the eggs. So it's after it is done with all these things, before it starts giving you signals that, okay, madam, we were here, we've been here for 6 months. And by then, treatment will become almost difficult. Okay. And then she gets this treatment and this infections and all that. She won't also treat it properly. So we keep eating till you get your problem and we go away from you.
Wow. So with this kind of ectopic pregnancy, a mature woman can experience it. Even a teenage mom. It doesn't matter your age. It
doesn't matter your age. However, one of the factors is a woman having a baby after 35 years. It's just a rare factor. Once a while it will happen that way.
Why would it happen that way? Just because you're that age?
We are still searching on why it happens, but most of the time we would say that your reproductive tract, your hormonal balances have reduced as compared to when you were younger. Yes, that's how it is.
Interesting. So when it sets in like that, this is maybe about a month. Our stage of the pregnancy it's not even developed. The egg is not even developed because it really, the fallopian tube really can't hold it. So this is the early stage of the pregnancy.
The first trimester.
First 2 months.
So 3 months in Podo.
Wow.
The first 2 months, because once you realize that you are pregnant, you are already 1 month gone.
Like you can't.
You can't say that I'm 2 weeks pregnant. No, you can't say that.
3 days. Because I've read like when you use even the test kits, even if the pregnancy is even 5 days old, it will give you accurate results. Even if you go to the hospital for a blood test, your HCG you
would
get
come out as you are pregnant. But this is how the technique is. Remember that I said you ovulate. And then the sperm travels to you, to your egg. So I ovulated 2 weeks ago. Before my menses will come 2 weeks later. So that 2 weeks ago, plus that 1 week that I have missed my menses, plus another week that I would say, okay, let me wait. Maybe my menses is delaying. I'll get my 4. So I had sex 2 weeks ago. My egg was, we have the 28-day cycle. Yes. So my egg came around 14 days. Now count from 14 to 28. How many weeks will you get? You will get 2 weeks. And then that 2 weeks, I would have missed my period and say, okay, my period is not coming. Maybe it's late by a day. Let me wait. I keep waiting till I realize that, okay, this is not coming. Let me do my blood test or my urine test, and then I'll be pregnant. So that period would have been up to a month. So you can't say that you are 1 week pregnant. No, it's just that you will say that I missed my menses a week ago.
But for the doctors to confirm and let you know,
it will be 1 month or gone, far away gone.
And that is so immediately if you have ectopic pregnancy, if your pregnancy is an ectopic one, you still test positive.
Exactly. You react like a pregnant woman will react until the embryo starts to be big or develop.
So that how will you tell?
So this is how you tell
that this pregnancy is ectopic.
An early pregnancy is not supposed to be painful.
Oh, really?
Yes.
During the first trimester?
You don't have to feel any form of pain. But with the ectopic pregnancy, you realize that you have pain around your pelvic area, your waist area. You feel like you want to poo-poo, but the poo-poo won't come, and your rectum or your rectum would be painful. It feels heavy, as if there's pressure there that you have to release, but you can't release the pressure. Okay? And then your shoulder may hurt, your whole body may hurt. It will be painful. Everything about your system will be painful, and you will have severe abdominal pains. Now, this kind of abdominal pain isn't the regular cramps that we get when we are pregnant. This is real pain that you can't do anything about. Not even painkiller will help you. These are the kind of signals that you will get, and then you will know that there's something going on. However, when you test for your pregnancy, you will be given the positive results. It says that when you do the HCG test, your
inner blood or urine?
That the HCG, that's for the blood. Let's do the blood.
The blood test.
So when you do the blood test, it will give you signals that your HCG is at a particular level. But then you do another HCG, let's say a week later, and it is still the same level. That is a signal that this pregnancy won't hold. Even though you are pregnant, it won't hold. So you go to the hospital. That is why we ask that when you test positive at home, come to the hospital and then start your antenatal services. When you come there, we also do the urine test again, and then we ask you to go for a scan. Now the scan is going to scan through or navigate through your womb and then check where exactly the egg is at. Okay, so when you are really pregnant, the normal way of being pregnant, your egg sac will be at somewhere within your womb, and then you will get it on the picture, on the scan reading. You would see it. However, if you are having ectopic pregnancy, it won't show in your womb. It will show elsewhere, and then that is where you'll be alerted. So this is a woman who has just missed her period. She has tested positive, and she has rushed to the hospital that this is what has happened. She thinks she's pregnant. So you see, at the earliest stage, we've realized that the sac is not in the womb but elsewhere, and then we treat her as soon as possible, even before she starts reacting to it. But there are instances where she will say she has the positive test, she will stay home. I will let my belly